DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. We have a friend and colleague of mine, Dr. Jacob Hagenmaier. We're going to talk about fatigue cattle syndrome. We're going to talk about things that you can prepare before you're going to ship fat cattle this summer. It's going to be a great show, so stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and here with my guest is Dr. Jacob Hagenmaier. Jacob is a veterinarian. He also has a PhD in diagnostic and pathology or pathobiology here from Kansas State University. Dr. Jacob is the Director of Clinical Services for VBRC here based out of Manhattan, Kansas. So welcome to the show.
It's great to be with you again, Dan. I'm excited for today's show and always fun to get to film a DocTalk with you.
So Dr. Jacob and I have worked together for many, many years, and he's a wealth of information. He's just an unbelievable talent in veterinary medicine, and so to have him on the show is exciting. And we're going to talk today about something that your research basically defined, and you spent a lot of time on this, called fatigue cattle syndrome. So kind of give us a little bit of background. What is fatigue cattle syndrome?
Yeah, no, it's a good introduction. And it's a time of year when in our feedlots, obviously, we're starting to see bloats and other digestive abnormalities begin to tick up as intakes roll up into spring. But one other, syndrome that we don't think about maybe as commonly just because it's not as old or we've known about it or recognized it for a shorter time is fatigue cattle syndrome. And fatigue cattle syndrome, dating back, it's hard to believe it's 2021, but in 2013 we first had some nonspecific cases of cattle with reluctance to move and decreased mobility at packing plants. And those are cattle that did not have, again, being nonspecific, an obvious sign or cause of lameness. So in our feedlots, right, we think of foot rot, musculoskeletal injuries, things of those nature. And these were cattle presenting with, again, decreased mobility, muscle tremors, but no specific cause of the actually decreased mobility. So made us begin to ask some questions about what exactly is driving this new clinical presentation in fed cattle at the time of shipment for slaughter.
And I think it's important to understand that we're talking about fat cattle being delivered to a packing plant that can't move. So what happens to those animals if they don't move?
Right.
Or
Obviously,
if they go down or can't move?
Yeah, so obviously USDA veterinarians perform ante-mortem inspections, and so these are very important things to prevent, because when we have non-ambulatory or downer animals in the lairage area at packing facilities, in some cases those animals do have to be euthanized after an amount of time allowed to recover. So certainly something from a welfare perspective that we want to prevent, but also financially, critically important to the owner. It's all the way to the packing plant and then not be able to have that animal harvested.
Yeah, it's a waste of natural resources. It's an animal welfare issue, as you point out, but there isn't a more expensive dead
Nope.
than one that's been delivered to a packing plant. And so big time hickey to your bottom line.
Yep, absolutely.
And about how often do you think this occurs? And I mean, is there a seasonal pattern?
Absolutely, it's seasonal. Again, rolling into the hot weather months is when we see prevalence tick up the greatest. So couldn't be a more timely time to be talking about it than May, about to roll into June and July.
Perfect. Well, we're going to take our first break. When we come back, more with Dr. Jacob Hagenmaier. You're watching DocTalk. We'll be back after these messages.
Bovine respiratory disease, sometimes known as BRD or shipping fever, is a serious threat to the health of your cattle and your bottom line. Zactran is ideal for the control and treatment of BRD because it's a broad-spectrum antibiotic with a high affinity for the lungs. After subcutaneous injection in front of the shoulder, Zactran is rapidly absorbed into the bloodstream. The antibiotic travels quickly in the bloodstream to the pulmonary epithelial lining fluid, or PELF, the primary site of infection in the lungs. In the lung, Zactran concentration exceeds the MIC90, or the concentration required to inhibit 90% of the bacteria, within 30 minutes. Zactran remains at this bacteria-killing concentration for 10 days. In field trials, clinically ill cattle treated with Zactran showed rapid improvement in the clinical signs of BRD. Most cattle with a body temperature over 104 degrees Fahrenheit showed a significant decrease in fever within 24 hours after treatment. Respiratory character scores and depression scores also decreased within 24 hours of treatment. These results were maintained for the 10-day steady duration. To help your cattle recover from BRD quickly, Zactran reaches the lungs, killing bacteria within 30 minutes. Treated cattle typically show improvement within 24 hours, and Zactran provides 10 days of therapy in one cost-effective dose. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older, or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been established.
Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why ZenPro developed ProCom as your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Jacob Hagenmaier. We're in Manhattan, Kansas, where Dr. Jacob is the Director of Clinical Services for VBRC. Dr. Jacob is a veterinarian who has done so much in private practice. He's done it in academia. Just a wealth of knowledge, and to get him to take some time out and spend with us, it's just great because his research is really what defined a lot of this, what we're talking about with fatigue cattle syndrome. So talk to me a little bit about what do these cattle present as when they come to the we'll cover two things. What do they look like when they get to the plant? And the other one is what are some of the, prevalence or some of the things that are risk associated with seeing it?
Yeah, driving factors. Yeah. Absolutely. So in our previous segment, we talked about non-specific form of lameness. And so I guess to dive into that a little greater. We're obviously well aware in feedlots of foot rot, musculoskeletal injuries, toe abscesses, hairy heel wart, those different causes of lameness. Unfortunately, more prevalent, in wetter months and things of that nature. But when we're talking about fatigue cattle syndrome, again, if we were to start picking up hooves, or with your typical veterinary physical exam, be a little bit more frustrated with regards to isolating an exact cause for the decreased mobility. And oftentimes we can have, it's not like just one limb is injured, it's all four limbs. It's a metabolic disorder at its core. And so we begin to think about the North American Meat Institute. They actually had a 1 through 4 scoring system that differs than our classical mobility scoring systems such as Zinpro and others, whereas this 1 to 4 system was specifically designed when these new cases of decreased mobility began to show up again about a decade ago. So a 1 in that system is clinically normal. A 2 would be shortened stride. A 3 is these animals' flight zones really become smaller and they become a lot more reluctant to move. And then 4, these cattle actually, they get statue-like and won't want to move. And oftentimes we'll have muscle tremors will be associated with the severe cases, so a mobility score 3 or 4. Other clinical signs will be increased respiration rate, oftentimes can be open mouth breathing. And so to roll into the second part of your question.
Well, let's hold on.
Yep.
Because I think it's really important that people understand that these animals look like, we have syndrome in horses called tying up.
Yep.
And that's what these cattle look like.
Yep.
At the plant.
Yeah.
Wouldn't you agree?
Yeah. So metabolic acidosis, high lactate, is a key blood abnormality involved with this disease. And when God made cattle, the one thing he made them deficient in is lung capacity. And so their ability for aerobic respiration, to get oxygen, to supply all those muscles. We've taken cattle to greater and greater harvest weights over the last decade because of economic signals, but our lung capacity likely hasn't kept up with those increased pounds. So more and more likely to have animals that get lactic acid buildup just like humans would get when we went to the gym and get sore, the next day or 48 hours later.
Yeah, I think that's great. And now that takes us to a break. So we'll be perfect to come in and we'll talk about those risks and driving factors as we come back out of break. This is Dr. Jacob Hagenmaier. We're just so thankful to have him on the show. When we come back from the messages, more on fatigue cattle syndrome.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why Zinpro developed ProFusion.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Jacob Hagenmaier. We're in Manhattan, Kansas, where Dr. Jacob serves as the Director of Clinical Services here at BBRC. He's a researcher extraordinaire and somebody I'm awfully proud of as a colleague and a friend, and whenever we get a chance to get together, we do. And today we're talking to Dr. Jacob about fatigue cattle syndrome. And let's talk about some of those driving factors, and let's lead out with the time of the year.
Yeah, probably the key impetus for you reaching out to talk about fatigue cattle syndrome is about to roll into June, July, August, obviously summer months and the hottest months of the year. The research, Elanco has a big database where they track mobility, and it would suggest, in addition to our research, that the hotter summer months are definitely the most prevalent for fatigue cattle syndrome. And that's primarily driven by just the heat stress on the animal and the ability to maintain aerobic respiration and prevent muscle fatigue as they go through the marketing channel, because it's outside of birth, maybe the most stressful and eventful day in a calf's life is the day he's shipped for harvest.
And then when we look at the cattle we're shipping today versus what it was 10 years ago.
If you go into the USDA data and plot carcass end weights,
Yep.
hot carcass weights and live body weights, last time I did it, we were at a rate of 10 pounds carcass per year that we've been adding on these animals since approximately 2010. So the question is, is our musculoskeletal system keeping up with as many pounds as we're putting on? So, anytime we take an animal past its optimal endpoint, it becomes financially costly because they're becoming less efficient. We have more fat, less edible protein, right? Lean meat yield. But then we also put the stressors on the other systems, such as the musculoskeletal system. So again, to drive home the point you were making, heavier endpoints being another key driver to fatigue cattle syndrome prevalence.
So if we have hot weather and heavier endpoints because of economics, we really can't control those.
Right.
But the aspect we can control is our handling.
Right. So control what you can control, right, as you just alluded to. And some things, when I was consulting feed yards prior to coming to VBRC, that we talked about, the number one is low stress handling. If you and I were to sit on a couch and eat potato chips all year and then be asked to walk a mile, it might be a little difficult for us, right? So be respectful of the events of that day relative to what that animal's been doing the 150 days on feed prior to that.
Use the lead rider. Walk the animals from their pen. Take your time getting them out of the pen.
Yep.
Walk them to the loadout.
What's funny to me is we frequently, when we have tub-based systems, we talk about not overloading the tub with regards to arrival processing, but loading fat cattle are no different, and actually more of a risk because we have that much more weight and that much more force that we can cause some pretty severe crushing injuries when we're trying to load too many heavy cattle at one time.
Which is also part of the syndrome of fatigue cattle.
Right. Creatine kinase, it's a muscle enzyme that we can measure in the blood. Very suggestive of severe cases of fatigue cattle syndrome, which our research would show. So anytime we have crushing injuries, that increases creatine kinase, muscle fatigue as they move into the next segment of the marketing channel, more and more likely to have issues with mobility if we have those precursors.
Perfect. Overfinished in the summer, aggressively handled cattle that are run to the loadout are going to cause problems. When we come back, we're going to talk with Dr. Jacob about how to prevent fatigue cattle syndrome. We'll be right back after these messages.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why ZenPro developed ProFusion Drencom as your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Jacob Hagenmaier, and we're here in Manhattan, Kansas, where Dr. Jacob is the Director of Clinical Services for VBRC. He's a veterinarian with a PhD in diagnostic medicine and pathobiology, and we're talking about fatigued cattle. And so you kind of alluded to at the beginning, when we have overfinished cattle in hot weather being run to the loadout or crushed or not mishandled. Talk to me about some of the things that you see people doing to prevent fatigued cattle syndrome so we don't have those downers at the plant.
Yeah, so the use of the lead rider is absolutely one of the biggest ones. It's an extra cattle handler, and every now and then feed yards might groan. It's hard to come by good help, but it'll be one of the most beneficial roles that somebody can play, preventing those cattle from getting ahead of you, going too fast, preventing those crushing injuries as you described. Staging cattle, as best as we have the opportunity to stage cattle near loadout areas, those heavy pens in these summer months, if we can provide shade, additional waters, have a portion of the feed yard, which again it's easier said than done, but the best we can accommodate fat animals because their needs are certainly different, right, than arrival cattle. So little things that we can do, having pens close to the loadout and scale areas to minimize the distance that those cattle have to travel on the day of shipping. Not a nutritionist, obviously you have the nutritionist training, but a good trace mineral program. We've talked a lot today about the musculoskeletal system, making sure that we're not having deficiencies in any of our trace minerals or macro minerals, right? So make sure you have a well-rounded nutrition program, which most feedlots do, but...
What about getting them out of the pen? I mean, I've seen people go into the pen and they haven't acclimated cattle or worked with the cattle, and they get in there and they just go around and around and around. That has to be a...
Yeah, so I guess first, having enough people is important, right? Not asking just one individual who's the least trained to go empty a pen is a big deal. We can do some things with pen design, which is a whole different discussion for a whole different day, to help with emptying pens. But when cattle haven't gone out the back of a pen, again, so long as we're not having big BRD outbreaks and having to send a lot of cattle to a hospital, it should be rare that cattle go out the back of the pen, right?
Right.
So they're always concentrated at the front. That's where the feed truck goes by. That's where the waters typically are. That's where the activity is. So all of a sudden asking the cattle to go out in an area of a pen. So little things we can do. Need to be getting cattle up anyway. It helps us find bloats, but get cattle up. If we can certainly open a gate and let those cattle have a little room to the back alley, if we know when they're shipping enough ahead in time, that certainly help prevent stress getting them out of the pen.
Yeah. Any last words on fatigued cattle?
Nothing in particular. Just important to continue the devil's in the details. And based on economic conditions and the way our industry is going, I don't know that smaller endpoints, at least real respectfully small, right? There might be small pullbacks depending on seasonalities and things of that nature, but I don't know that we're going to go back to harvesting 1,200-pound animals. So, the prevalence of this disease, it's been shown for now almost a decade. And so, again, devil's in the details. Use a lead rider, get cattle shipped or at least to the loadout areas. Being respectful for schedules. If they're coming in the afternoon, obviously in the morning's not a great idea, but try to provide yourself the time to not be rushed.
Perfect. Folks, Dr. Jacob Hagenmaier. Remember, if you want to learn what we do at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian, and for Dr. Jacob Hagenmaier, I'm Dr. Dan Thomson, and we'll see you down the road.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.